Now let's see what happens when there is not enough glucose entering the cell and the cell function suffers. Depending on where the cell is, symptoms occur. So when the brain cells do not get enough glucose, there is confusion, inability to focus or concentrate on issues, irritability, and in severe cases there can even be seizures. But confusion, irritability, inability to focus, inability to concentrate on issues is a common feature of diabetes. When those brain cells which are related with our satiety, when we eat food, some cells in the brain say, okay, you have eaten enough, you can stop now. When we are hungry, some cells say, okay, go and eat. So those cells, when they do not get glucose, they think that we haven't eaten our food, so they order our body and mouth to go and eat. As a result, those patients who have diabetes eat excessively. So excessive eating is an important feature of diabetes. If the cells that are not getting enough glucose are in the muscles, then the person feels easily tired, easily exhausted, takes a long time to recover even after smallest of jobs the person does. So easy fatigability, tiredness may be because of diabetes. When the cells in the body that are forming new proteins for the body do not get enough glucose, there is weight loss because the body is not able to form new proteins. It is using the old proteins but is not forming the new proteins. It is breaking the old proteins down but is not forming the new proteins, and there is a weight loss. This weight loss can be very dangerous because it is associated with many other problems like production of excessive acid in the body, production of other poisonous substances like ketones in the body, and excessive acid can lead to problems with the beating and the rhythm of the heart, and even can cause unconsciousness. So lack of glucose inside the cells, lack of ability of cells to consume glucose leads to serious problems including excessive eating, excessive tiredness, excessive fatigue, inability to focus, inability to concentrate, confusion, maybe seizures, weight loss, production of excessive acids, ketones, and maybe even loss of consciousness. So if you have any of those symptoms, then do not hesitate to get a blood test done for checking for diabetes, because nowadays it is so easy to get this test done. It can be done within a few minutes and you will know the answer. But missing the diagnosis of diabetes can cause serious disability and even death in the long run. So if you have any of the symptoms that we talked about in diabetes, and especially if you have a family history of diabetes, please call your doctor and get checked for diabetes. Knowing is much more better than not knowing, because once you know the diagnosis, you can manage the condition.